Hello and welcome back to my channel, Dr. Magnesium, with me, Dr. Lee Keegan. And today I'm going to do another short video relating to the idea or the theory of food-based pathology or diet-based pathology. So this is probably quite a new concept to a lot of people watching this video, and it's probably something that you don't think about very often. People don't think of food as being a direct cause of pathology. And every time people eat, they're not thinking that this is potentially harmful. Probably not in the same way that somebody would who smokes. I think there's a lot more awareness to, if you smoke, with every lungful you take, you probably question yourself about whether you're doing harm to your body. A lot of people probably don't have the same thoughts about food, but it's something that it's a big problem in the Western world, definitely. It's something that as a doctor working in acute medicine on the front line, we're seeing more and more year upon year, and it's a problem that is being stored up for the future. When you look at childhood obesity levels, it's only going to get worse if we continue down this road that we're on currently. So firstly, you're welcome to go back through my previous videos. There's a lot of videos explaining how UPFs directly lead to pathology, whether that be obesity or cancers or cardiovascular disease or cerebrovascular disease. But for the purpose of this video, I'll just go over it briefly. So ultra-processed food can have a direct impact on the bowel. It can cause irritation of the bowel. It can cause inflammation of the bowel. It can stop the transfers of nutrients correctly passing the bowel. It also leads to high levels of sugars and fats being stored through different mechanisms. So ultra-processed food tends to be nutrient rich but fibre poor, meaning that it transits through the gut, so through the mouth into the stomach and out the other way very quickly. As a direct result of that, you don't have the fibre slowing the transit time through the GI tract. So the body tends to panic and draw in a lot of the fats quickly, which is stored in adipose tissue or fat storage cells, leading to a hyper absorption or storage of fat, which leads to obesity. It's way more complex than this. This is an oversimplified version, but it causes hormone dysregulation, inappropriate secretion of insulins, which again directly affects the weight, type 2 diabetes as a result of metabolic syndrome. So there's a lot of different ways, and please feel free to go back through my videos. I don't want to go through every single one here because it would take too long, and people would get bored and switch off. So that's the thing that we have established, and we've established in previous videos. It's basically common knowledge now. It's nothing cutting edge or revolutionary. It's that ultra-processed food leads to obesity. As a direct result of this obesity and the malabsorption of certain nutrients and overabsorption of other nutrients, a plethora of resulting pathologies occur secondary to this. So looking, just as a quick aside, I was speaking to one of my emergency medicine colleagues just last week, and we were going through the board of patients that were coming in, and patients that I'd seen and patients that he'd seen, and we were doing a quick audit, not very scientific. We were just going through it ourselves, and we were looking at the kind of patients that were in and the ultimate reason why they were in. And most patients who were on that board were there because of diet-related issues, whether that be cardiovascular disease as a direct result of being overweight, whether that be diabetes-related illnesses, strokes, we had infections. Again, infections, if you've got a poor diet, you take a lot of ultra-processed foods, you don't have that kind of regulation that normal people would have, or people with a good diet would have. The immunoproteins, level of immunoproteins, you wouldn't have that same response that somebody who eats a better diet would have. So looking through the hospital and the patients that were coming into the hospital, it's clear that this is a big issue. It's probably the biggest issue, I would say, with patients coming in is diet-related pathology. So it's pathology or sickness that is directly as a result of the food that we're eating. The food that we're eating being ultra-processed food, leading to other conditions such as inflammatory bowel, such as hyperabsorption of fats, or the porous inner layer of the bowel leading to fats crossing into the blood and being stored inappropriately, or whether it causes irritation, molecules that shouldn't be in the blood causing irritation to blood vessels. Blood vessel irritation causes openings which fat gets into, then you get this fatty plaque formation in cardiovascular disease or in cerebral vascular disease, or you get these sharp molecules secondary to diabetes which cause damage to the kidneys, damage to the eyes, damage to the nerves. More and more evidence now pointing towards dementias being related to these diabetic rough sugar molecules secondary to diabetes. There's just so much evidence out there now, and it's something that can't be argued with, the level of disease that we're seeing secondary to ultra-processed foods. So I just wanted to highlight that as a philosophy, as something that you've probably never heard of before, or probably never thought of, the fact that food-based pathology exists. And food-based pathology or diet-based pathology is a massive problem in hospitals. It's a massive problem to the amount of admissions that we're getting, and it's something that's only going to be stored up over time. It's going to get worse. If you look at previous videos in which I've showed levels of obesity in the young, so in some poorer areas within the UK now, we're looking at 35% of children being obese by the end of year 6. So by the end of leaving junior school and going into the senior school, or year 7 as they now call it, 35% of children are obese. And this only tends to get higher as you get through your teen years. People tend to store fat and go bigger, they don't tend to come down the other way. So these are massive problems that are being stored up. Watching Jeremy Vine or programs like that where you're getting these people on, like the Fat Doctor, who are telling you that obesity shouldn't call children fat, this is a negative psychological effect, you shouldn't tar them with this brush, we should be looking at other ways to solve future issues. Obesity levels are the main issue, and what we need to tackle is childhood obesity, and we need to address the issue that's storing up, which is going to be a massive burden on the NHS over the next few years, if the NHS still exists over the next few years. But this is something, again, so just a short synopsis of this video is I would like to introduce the idea of diet-based pathology. I would like to introduce the idea that ultra-processed food causes damage to the body, which is irreversible damage to the body, permanent, long-lasting damage to the body that leads to pathology and leads to poor outcome. I'd like to then take from this the levels of childhood obesity are increasing over the years, and that this is a massive problem that we're storing up for the future. So thank you for watching this short video. I hope you find it helpful. I hope this has enabled you to think a little bit differently about food. And please, if you like my videos, subscribe, share and follow me for further videos. Okay, thank you and goodbye.